My name is Victoria Cruz. I'm a medical student at the National Autonomous University of Honduras, and I'm a member of the board of the Honduran Medical Education Association. The name of our abstract is A Guide for the Design and Evaluation of Continuing Medical Education. We need to start talking about what is continuing medical education and its importance. UNESCO defined continuing medical education in 1998 as the main focus of the educational system that should meet the needs and opportunities arising from the knowledge of the new century. Continuing medical education involves different tools for a clinician's professional development. This is really important because in the medical area, you never stop learning. With time, everything is evolving, and what someone learned 5 years ago is not the same at this moment. So we need to keep our knowledge updated. This being said, we decided to create this guide because in my country, Honduras, we didn't count with guidelines that regulate our learning system, and this created gaps that affect the performance of the health workers as well as the patient care and their outcomes. We focus on 3 stages to follow for the design and development of continuing medical education activities: the pre-event, the event, and the post-event. I'm going to start talking about the pre-event. When we want to develop activities for continuing medical education, we need to ask ourselves the question: what does the physicians want to learn, and how can we find out what they want to learn? This is important to understand the gap of knowledge health workers can have. Some examples of how we can gather this information are collecting information about the evaluation hospitals and centers perform to their health workers on their work capabilities. Also, find out about the most frequent diseases in those centers and how they are being managed, and the challenges the physicians present at the moment of evaluating a patient. Once we have this information, we can use the proceed model to start implementing activities that can help the physician gain clinical competences to apply in their medical practice. I'm going to talk about the proceed model. This was established by Green in 1974, and in 1991, Kruger added the proceed component. This model covers 4 areas, and we will apply them in the healthcare programs. The first one is determine, develop, execute, and evaluation of these programs. After applying this model, we're going to follow the second step, the event. How we're going to develop the continuing medical education activities. To do this, we need to start by having in mind what's our goal. In this case, implementation of activities that help the physician gain clinical competences. We also need to consider the learning stages a physician have and focus the activities we develop in clinical scenarios that they can apply to their medical practice. The last step will be perform an evaluation to the health worker and get feedback to them based on their performance. We focus these 4 steps on Miller's pyramid. This model provides a framework for assessing clinical competence in medical education and can assist clinical professors in matching learning outcomes with expectations of what the learner should be able to do at any stage. This scheme includes 4 areas. The first one, the physician knows, the declarative knowledge. To evaluate this area, we will discuss with the health worker different topics for the training using different resources, such as presentations, articles, webinars. The second one is physician knows how. We can use this by discussing clinical cases or reports, and the health worker should know the objectives and the clinical criteria to solve them. The third one, the physician shows how. The physician should apply their knowledge in clinical cases using different resources such as patient simulators and virtual patients to apply their knowledge. And the last area covers the physician's performance and will be covered in the last stage, the post-event. In the post-event, we include the evaluation of the physician's performance. How we're going to do this? We need to evaluate the physician's performance by focusing on 4 areas. First one, if there's an effective patient care. The second one would be effective doctor-patient communication. The third one will be how they prevent diseases. And the last one, the administrative and clinical management. Also, we can analyze the morbidity and mortality in a center. That way, we can understand how the knowledge of the physicians was applied and the outcomes of the patient. For this, we can use an evaluation model, Kirkpatrick, that includes 4 phases. The first one, reaction. The learners determine if the activity is favorable, engaging, and relevant to their jobs. The second one, learning. They receive what knowledge the people acquire regarding their skills, the confidence they have, and the commitment to the training. The third area, the behavioral change and how it impacts their clinical development. And the last one, and the most important, is the result, how it impacts the patient's life and outcomes. This guide is really helpful because it illustrates the necessary steps to plan continuing medical education activities and achieve the desired academic impact on the health workers. It can also be used by different medical institutions, universities, students, and organizations. I hope you find this information helpful. It's a pleasure for me and my colleagues to be part of this event. This is the link to our published article. Thank you very much.